I'm very pleased to stand here and discuss with you. I don't want to say tell you, but discuss with you of some of the progress we're making here at Regional Health Services, Region number 6. The Ministry of Public Health, in their attempt to ensure that all and sons should receive quality health care, has rolled out a Health Vision 2020. Health Vision 2020 is a plan that states by the end of the year 2020, that's about 4 years from now, it will state where we as a region or we as a country need to be as regards to health service delivery. In Region 6, we have embarked on a program that called PEHS, the Package of Essential Health Services. PEHS is directed towards the district hospitals and health centers. Because we are determined in our efforts to ensure that the health centers and the district hospitals, of which we have 3 health centers in the region and 26 health centers and health posts, we determine that if you access any one of those facilities, you must be able to get the standard care across the region. So that's why it's termed PEHS, the Package of Essential Healthcare Services. With that being said, we have decided that the only way to achieve this, we cannot just depend on central government for funding, but we need to ensure we forge good partnership with stakeholders, hence Food for the Poor and Guyana Medical Relief Inc. Over the past 6 to 7 months, Food for the Poor, under the directives of Ms. Alex Foster, who is also the president of St. Francis Community Developers, we have embarked on a number of outreach activities that will ensure that the public regains trust into the public health system. And last week I was in Georgetown. Somebody indicated to me that while we're doing good in the region, we need to ensure it's evidence based on our data. So I want to just give you some data. I want to use some of Dr. Sharma's stats here. Dr. Sharma, permit me to use some of your stats to give you some data. Between the years 2010 to 2014, the patient ratio in the region was just about, let's say, 140,000 per year. Or for the first 6 months of the year, it would be like about 60 to 65,000. In the year 2016, for the first 6 months, we have already seen and provide care to 89,000 patients. So it is an increase by just about 9,000 persons in some cases. It therefore means that, one, either the economy is bad, which I do not think is bad, or also it could be the fact that persons are finally regained confidence in the services we provide them to the public, which I think augurs well for the development of health in this region. Once we continue to build trust with the community, we will be able to achieve our mandate by year 2020, which to ensure that there is equal access to healthcare services across the region, from health posts to health center to district hospitals. It is our vision that the patient could walk out of the community and go to the health center and receive all the necessary treatment or care that is standard with the health center across Guyana. I know at the moment if you go to some health centers, there is access to a little bit, while at some others there's more access. The idea is to ensure that all our health centers have a standard service delivery and all are providing the same care for patients. To achieve that, like I said, collaboration and partnership. And I want to say how happy I am and appreciative I am that Guyana Medical Relief Inc. has contributed to the cost to the magnitude of 18 million Guyana dollars. So whatever we presented today to the district hospitals and health centers is a value of 18 million. I said 80,000 just now? 18 million. I thought I said 18,000 because nobody like okay, wow, or clapped or anything. So I thought I said 18,000. But it's 18 million Guyana dollars. It therefore means the persons that we are determined to represent, the poor of the poorest, will be able to access healthcare delivery, medications and supplies easier than they could have done it a couple of months ago. Alright? So Alex mentioned that there's always some publicity on what is short, but there's never publicity on the surplus. I can understand the challenge, Alex, with media. And you know, like I always say, sweet news sells faster than sometimes reality. But I'm standing here and I notice I notice 4 or 5, 6 media personalities that have been very good to help in the region for the past couple of months. And I want to urge them to continue doing just that, highlighting what is actually there. Bear in mind, I'm not saying, like Alex said, you guys just give us negative publicity. I'm very happy, all my reading and my television viewing, that the media has given us good reviews of late. Therefore means that something good is happening in this region. And all the persons here, as part of health services, need to give themselves a round of applause for continue to stick by it. I know some days there's good days, there are bad days, challenges, and every opportunity. But perseverance is always the key. And I want to urge to continue persevering, because we here, we know what we're all about. We know where we want to be. And I want to tell you that the only way we can achieve that, be right path, the only way we can achieve that is continuous collaboration with stakeholders like St. Francis Community Developers, like Food for Poor Guyana Inc., like Guyana Medical Relief Inc. This morning, I had a meeting with Help Guyana. That's the humanitarian assistance program out of the U.S. Embassy. Alex, the coordinator, said he met with you sometime last week, and they are determined to come to the Region 6 and assist us. I think they visited Skeldon Hospital already, and they have already committed a number of drugs and medical supply items to the Skeldon Hospital. When these items go to the Skeldon Hospital, that entire catchment area of over 45,000 persons will benefit. The catchment area of Skeldon Hospital is from 43 on the Corteen, has extended to Suriname. Because I know, based on our numbers, we are seeing a lot of Surinamese patients these days, which is also a kind of a challenge for us to quantify and forecast based on numbers. It must be noted that in Guyana, our healthcare system may not be perfect, but persons from out of Guyana is willing to accept and come to benefit from our services. Healthcare in Suriname is very expensive compared to healthcare in Guyana, which is free, absolutely free. Every service at our public institutions are free. When persons come to us, and we don't ask your nationality, we don't ask your ID, and those things. The first thing we do is try to give you that care that you deserve. So we noticed that last year, for the first 6 months last year, through the public health system or maternity gynecology, that we would have seen 918 patients for the first 6 months last year. At the same point this year, we've seen 1,237 patients. That's an increase again. In the report of MCH, Maternal Child Health Report, that report will indicate that their record shows just about 1,100 patients coming through that system. So myself and Dr. Sharma had a challenge. If Nurse Terry is saying to us that our records is just over 1,100, but out of the hospitals, I told us 1,237, where are the other patients coming from? As upon investigation and checking back record and some data collection, that we realize that these other patients are Surinamese. So we now start forecasting in our budgeting and our preparations for our discussions on drugs and medical supplies of a number of persons coming from Suriname to access our services. Also, Region number 5, other than Skeldon Hospital, Region number 5 would have transferred more patients than any other facility in this region to New Amsterdam Hospital. So Region 5 patients are also frequenting our facilities and benefiting from services that we have to give out. Those two factors pose a challenge on the system. Because if we are catering for, Dr. was the number 109,000, how much, 418 population? Just about 110,000 persons in Region 6. We now have to consider the 17,000 that come from Suriname and the 4,000 that coming from Region 5. So sometimes when you hear drugs is short, it's not because you do not quantify or do not forecasting, it's because now there's an added strain on the system. And we are not prepared to turn back anybody that comes to our facilities. Once you come to the door or the gates of our facilities, you will be given the treatment like any other Guyanese at equal access to healthcare. So that is our vision. We are in the year 2016, and we believe that while it is Health Vision 2020, at this rate, we can achieve our visions by mid-2018 if we continue to work in collaboration with our stakeholders and to ensure the residents of Region 6 benefits, because they are the beneficiary of whatever we do here. So once again, I'd like to thank Guyana Medical Relief, Inc. and Food for Poor in Guyana for a contribution of drugs and medical supplies to the tune of $18 million that will enhance healthcare delivery in Region 6. Thank you.
On behalf of the Executive Director of Food for the Poor, Mr. Ken Vinson, and the Head of the Gibson Kynes Department, Mr. Jamil Davis, who we work with directly, we would like to thank Food for the Poor Guyana for what they are doing to us. And on behalf of Food for the Poor Guyana, it is my honor and privilege to continue to try to source this type of support to this region. And we would like to thank all the faceless donors in the United States of America who constantly contribute to ensure that these donations can be possible. I trust on behalf of Food for the Poor that the doctors, nurses, community health workers present here will ensure that the stuff that are given free of cost to the hospitals and health centers are utilized for the intended purpose that they came for, to benefit the poor of the poorest, as Food for the Poor Guyana tries to support and help the persons across this beautiful land of ours. So if you can be able to deliver a service second to none, then I will be able, on behalf of the residents of this region, to negotiate with our donors in Georgetown and the United States of America, second to none. I leave for the United States and Canada this month end, where I'll be negotiating. So this afternoon presentation, its success in the media will help us to negotiate even a little better when people know that the stuff that they are sending here to us in Guyana is actually getting down to the people who they are intended for. That's why these public presentations are very much needed. I do not like these public presentations because I have to be careful with every word that's coming out of my mouth. I would like to acknowledge the arrival of the doctor at the Cottage Hospital in Maibikuri, Blackbush, Poland. Thanks for coming on, and privileged to make this presentation on behalf of the two donors to the Regional Health Services, Region number 6.